Good afternoon, everybody, and welcome to CaraConference 2020, HIV Now and Next. We had hoped to bring everybody together in person this year, but like so many things in 2020, we've gone virtual. We do hope that you enjoy this week's learning experience. And before we start today's session, I have a few items to go through. If the slides will advance. So CaraCol is Cincinnati's comprehensive AIDS service organization with a mission to positively change lives in the fight against HIV. You can find us on Facebook, Instagram, or Twitter with the handle @WeAreCaraCol. And if you're feeling social today, please tag us and use the hashtag CaraConf. If you're joining today's session from a laptop or a desktop, your screen should look similar to this. And if you have technical related questions, please use the chat function. The chat function will have somebody monitoring that function. And if you have questions related to the content of today's presentation, use the Q&A function. We'll also have someone monitoring that and then getting the questions to the presenter for you. If you are joining us from a mobile device, you'll still use the chat function for tech issues and Q&A for content related questions. To find the chat function, click the More button at the bottom right of your screen, and to find the Q&A function, the button is at the top right of your screen. We'd like to thank our sponsors. Our presenting partner is Maytech, the Midwest AIDS Training and Education Center at the University of Cincinnati. Our sponsors are Gilead and Thera Technologies, and support comes from Grace Hospice. Today, we have a message from our sponsor, Gilead. Support comes from Gilead Sciences, a research-based biopharmaceutical company whose mission is to discover, develop, and deliver innovative therapeutics for people with life-threatening diseases. Gilead seeks to improve the care of millions of patients living around the world, including regions where access to medicine is limited or does not yet exist. Thank you to Gilead for their support of CaraConference 2020. And finally, at the end of this training, there will be a link that pops up with a survey. Please complete this survey. We value any and all feedback. If you are seeking continuing education credits, you must complete that survey. And now I'm going to turn it over to Linda Sider, CaraCol's Executive Director, to introduce today's speaker.
Thanks, Adam. And again, welcome to the third annual CaraConference presented by CaraCol, the region's AIDS service organization. And again, I'm Linda Sider, the Executive Director. So as Adam mentioned, we hoped for a full day in-person education and networking opportunity, but like so many events this year, it's gone virtual. Although we're disappointed not to be in the same room, this experience will provide the high quality that I think you expect from CaraConference. And so we're excited to be here, even under these circumstances. So to kick off this week of education, we're really excited to introduce Sarah Semelka from the AIDS Foundation of Chicago to talk about ending the epidemic planning efforts. We hope this presentation will inform our local planning efforts, which are underway as we speak, in our overall shared goal of getting to zero with new HIV infections. Today's moderator will be Adam Riley, whom you've met, CaraCol's Testing, Education, and Outreach Manager. Again, we'll help field questions during this session. And so again, thank you so much for joining us for CaraConference 2020. And with that, I want to turn it over to Sarah.
All right, thank you, everyone. And again, I'm just excited to be here today virtually with you all. I'm going to share my screen now, so thank you for bearing with me as I just get that fired up. And then we'll dive into the presentation. All right, and I'll just go to full screen mode. Okay, so again, if there's any issues with visualizing or hearing me, please type that into the chat and someone will alert me. But until then, we'll just dive in. Again, my name is Sarah Semelka, and I'm here today to talk about building and ending the epidemic plan, which we've been working on in Illinois for the past 3 years or so. I use she and her pronouns. Again, as mentioned, I work at AIDS Foundation of Chicago. I'm a senior project manager there. I've worked at AFC since actually about 2012, and I began as an intern there. And before working on any kind of ending the epidemic efforts, I was working on new prevention technologies, including PrEP, focusing on PrEP for women especially, and also internal or female condoms. But then in 2017, I began working on our Ending the Epidemic efforts in Illinois, and AIDS Foundation Chicago has always been very passionate about that project in our state, and really been a leader along with several other health departments and agencies across the state to make our plan. So again, what we're going to be talking about today, what I hope to share, I just want to share about our process for various elements of making our plan. Now that we're in the first year of implementation, it's been interesting to remember how this all came together, lessons that we've learned, things we would have done differently. And I'm excited too for people, if you want to talk more after this, to mentioning, like, obviously these conferences usually about networking. I'd love to talk more as Ending the Epidemic efforts are underway in Ohio, especially as a fellow Midwestern state. I would love to connect more afterwards as we go through this together. But today we want to talk about building crucial alliances with partners to ensure effective, impactful Ending the Epidemic plan that is rooted in community, accountability, and efficacy. Navigating the creation and maintenance of intergovernmental partnerships, which are so important with this work. Creating, evaluating, and examining community engagement activities in attempts to go beyond transactional or extractive community encounters and move into co-creation with our communities. Coordinating work groups to create an actionable plan, and securing funding as well to support the work. So just before we dive in, just a little bit about where we're from. Obviously people know Chicago is in Illinois. AIDS Foundation Chicago is based there. There's a little background of where we were kind of coming from when making this plan. We are a Medicaid expansion state. When the plan was kind of coming together, we had a Republican governor, and now we have a Democratic governor inaugurated in 2019. So we've had kind of a mix across political spectrum of our leadership as we developed our plan. We're home to about 12.7 million people in Illinois. Pretty obviously our biggest population concentrations in Chicago and the surrounding area. We have about a little bit more than 2.5 million people in the city, and then in the suburban or collar counties, we call them, we have about 8.5 more million people. And then we also have small towns and rural areas across the rest of our state for the rest of our 1.5 million Illinoisans. Just a little bit about the makeup of our state. The most recent data we have in terms of our epidemic status, HIV epidemic in Illinois, is from 2018. We get these numbers from our State Department of Public Health. So this is what we had in December of 2019 released. About 42,500 people living with HIV. That's an estimate because we right now just have 36,413 diagnosed. You can see kind of the breakdown of that among race and ethnic background. About 47% of folks living with HIV in Illinois are Black, about 27% are white, about 20% Hispanic. When it comes to sex at birth, about 80% of people living with HIV are male, and about 20% are female. You can also see the age breakdown there between people in their 20s, people in their 30s, and then 40 plus. So just a quick snapshot too to say since 2009, HIV diagnoses have been decreasing overall, which is good, a good trend. But when you break it down into population specifics, you can see that not everyone is experiencing that downward trend equally. New diagnoses are actually up among 20 to 24-year-olds. They're also up among Hispanic, Latinx, Latino men who have sex with men are up. In addition, in 2018, HIV diagnosis rate among Black males was 2 times higher than that, among the rate of Hispanic or Latinx males, and 8 times higher than white males. So that is something we want to have at the top of our mind and cognizant of as we're making these plans and implementing plans and making sure that our priority populations are getting addressed and that everyone reaches zero. So we have created a plan, like I said, that was launched in 2019. So to address the disparities, social determinants of health, PrEP, HIV, medication access, and all the things that kind of go into reducing new HIV transmission. So that was kind of the end result of our planning process. Obviously, we have it online. It's at gtzillinois.hiv. I can again drop that in the chat and in the follow-up emails that we can make sure that you can access our plan online. There's a PDF, also an interactive plan. But how did we get to this plan? So there's many lessons we learned along the way. It was by no means a straight line from conception to publication. We learned a lot as we went through this process. One kind of overall theme that we learned is the structure of like putting together this plan. I don't know if people want to put in the chat, or as we go into Q&A, where Ohio is in terms of with the federal ending the epidemic planning, because that was a whole new layer. We started all this before that was even a thing back in 2017. So it was really just discussions about could we end the epidemic. There at that time were already plans in like Washington State, in New York State, San Francisco, Houston also had a plan at that time. So the plans were kind of popping up. And we're saying, oh, like, could we do this in Illinois? So it was really more like conversational. Like I said, at AFC, we had people interested in that. Some of the research institutions in Chicago, as well as Chicago Department of Public Health, Illinois Department of Public Health. So it was conversational. We started to kind of build a framework. But over the years, as we realized we wanted to make an actual plan, we got funding, for example, to kind of help support the work. We had deadlines, dates, and deliverables, and decisions needed to be made. So we kind of went from more of a conversational, loose, organic structure to like we had to have kind of like almost an org chart. Who's going to make a decision? Who's going to enforce deadlines? Things like that. And we had to get a lot more structured and kind of get organized a bit more to actually make this thing happen. We also realized we had staffing needs. Again, at the beginning, it was conversational, it was people coming together over conference calls. Again, this is back in 2017, but we realized we really needed a dedicated staff person to do this. We began actually like a 6-month contractor. Then we added a full-time employee. So I was brought on just like this would be my main job to coordinate this. And since then, we've actually added another full-time employee. We found it's nearly impossible to do this without a dedicated staff person. So thinking about how to make that happen, how can you get a staff person or maybe a team of people working on this to make it all come together? And then another kind of thing we learned along the way was about timelines. The whole process of this, everything we did took longer than we thought it would. Every single time. It was because it's just, you have all these plans and you think of this great timeline, but then real life happens and people just get back to you later. Or you have some other thing take precedence. Obviously this year of 2020, we've had this global pandemic, but like there are flare-ups of many different either political or public health issues that really had caused us to have delays or things take longer than we thought. So we first started out with our planning. We had, planning conversations. Then we wanted to do public engagement, of course, and see what people in Illinois thought, people receiving services, people working on the ground. What are their thoughts for the plan? We gathered data from them. We had to analyze that and see what they were saying. We put out a survey, for example. Then we had to draft a plan, which was like synthesizing all that information. But then we wanted to make sure what we put in the plan was what people had told us. So we had a round of feedback and then more editing. So, and again, each of these took just longer than we thought. So it took us 3 years altogether from when people first started talking about the plan to like actually publishing it. We had first created a framework, then we had 3 months of public engagement to start on the making the full plan. Then we had 6 months of group work to put together the plan. We had a month to kind of synthesize everything the work groups did. Then we had 6 weeks of writing. Then we had a draft plan released. Then we had another month for another round of feedback. Then 3 more months of writing, editing, designing it, the actual plan, translating into Spanish. And so each of these kind of pushed back. And we actually ended up releasing we thought we were going to release the plan in December, World AIDS Day of 2018. And we actually released the plan in May of 2019. So we can see how things just took a long time. And reality is going to really butt up against deadlines that are given to us by funders, by the public, and by federal ETE timelines, if you're working within that framework as well. So yeah, it takes a long time to do this and to really especially create that kind of feedback loop from whoever's writing the plan to the community, and making sure you're communicating out, and then you're getting feedback from people. So it really just took quite a bit of time. We learned that. So I'm going to attempt to do a poll, Adam, if you want to deploy that, but here's what I'd like just to hear from folks. What do you think would provide the greatest challenge when it comes to creating a plan? Whether that's the community engagement piece, maybe analyzing data, drafting or writing, or some other thing that you might want to share in the chat, because there's a lot of elements that go into it, and some things you might already really have good practice in or have processes for, but other things might be more challenging or take more time.
Sarah, we've got the poll open right now.
All right, are votes coming in? Can you tell?
They are. We've got 49 of 88. It's going up quick.
All right, great. Well, feel free, Adam. I will let you be the judge of when to close it, and then you can share the results.
Okay. Once we get close to the total number of participants, I'll go ahead and close it out.
Sounds good.
All right. And then let's share the results. Are you seeing those, Sarah?
I am. I don't know if others are or are not. I can read them off really quick though. We have, what do you think will provide the greatest challenge? So the thing that people put most was community engagement, with 70% of people saying that to be the greatest challenge. 17% of people said analyzing the data that you gather from that. And then only 11% of people said the actual drafting or editing or writing of the plan. And then 3% said some other thing might be the biggest challenge. So far and away, it seems like community engagement are what people said would be a big challenge. And I agree that is, it is a huge challenge, definitely, especially even if you're doing only a citywide thing, but especially if you're doing statewide, that is tough. And so, and it provides a lot of challenges, but it's also can be so great too. So we'll get into that, but I appreciate you all taking part in the poll. And I'm gonna now see if I can, Adam, did that advance to the next slide? Are people seeing the next slide?
Yes, it did.
Alliances, great. Okay, so moving on. We'll get to community engagement for sure. But quickly, I'm going to touch on building alliances and how that can help and the need for that. So, bringing city and state governments together, that really helped us. We had initial buy-in, like I said, from those kind of beginning conversations before we launched into the whole official process. We definitely had the city of Chicago. We had several people on board that were talking with us, and we're like, yes, this is a great idea. There was actually someone in the city of Chicago Public Health Department that had been involved in writing an ETE plan for another state. So they were already like, yes, this is something that they want to do and they think is important. We also had enthusiasm from the Illinois Department of Public Health. And so, again, what we ended up doing, and we to this day, even still, we have monthly calls with folks from IDPH and CDPH, Illinois, and Chicago Departments of Public Health, to make sure that we are sharing information, sharing ideas, and that we're on the same page, and that we are all maintaining forward momentum. It's important to get buy-in from other key players, like health departments and hospital systems. We had a great relationship, for example, so say we're in Chicago, more in the middle of the state, Champaign-Urbana, our two cities next to each other. There's our state university is there, but it is definitely a whole different context than Chicago. And they have been an amazing leader for years and years and years in HIV, just in general. And we had a couple people from that health department that were like, yes, let's do it. We had done trainings with them. We really kind of strengthened our relationship years earlier by doing PrEP trainings and just prep education with them. And so we kind of used that relationship to say, like, what do you think about getting to zero? And they got on board. We had the Cook County Health and Hospital System, and then we have something called the Core Center, which is, again, dedicated to HIV treatment. And so we had a few really key people from the Core Center, again, that were just really excited by the idea and wanted to join and make it happen. So that was really key for us. I realized that we had those relationships, and then to get and find champions and get other people excited. I would definitely remember, like I said, we had a physician at the Core Center, Dr. Toyin Adeyemi. She was on the radio talking about getting to zero. Like I said, she was such a charismatic person, and she was so excited about getting to zero, and still is. But I'm just thinking back to when we were planning. And so just really like pumping up that enthusiasm. Like she was just amazing. And I realized like she got her people excited about it and just was enthusiastic in general. And that was like so great for us. So that was like a really key thing. Again, to kind of build up alliances and get more buy-in and like get yourself out there. We really presented at a lot of community group meetings and made ourselves available to show up at their space and present and answer questions. So especially the beginning, trying to get out there, no one knew what Getting to Zero was. We didn't have a logo. There's nothing like that. It was just kind of this idea. So again, the coordinator at that time was not me, but she really went out and was, whenever there was a community meeting, if there was a CAB meeting, if there's already groups in Chicago meeting, and then other groups across the state too. It wasn't just in Chicago. We wanted to go to those spaces, try to get on their agenda and make a presentation and make having some kind of call to action that people could do. We used a platform called Basecamp. It is still we still use it. It's called Basecamp, but we had regularly scheduled calls. We said, again, trying to get like a bit more organized, and we posted the notes from those calls on Basecamp. So we could keep people in the loop, whether or not you could join each and every call or each and every meeting, because no one can join every single thing. But just like remembering to do that, remembering to keep that updated. And so people knew that they could come back there and find notes, for example. And then doing one-on-one outreach, meeting with people where they're at and demonstrating how contributing to an End the Epidemic will support their values and align with their goals. No one wants to hear that you need to do like heaps of extra work, or this whole new thing. But if you can talk about how it really is where we are already going, we all already doing this work, it really aligns with our values. We just need to kind of be pointing all in the same direction. That helped. Again, kind of get people excited about it and wanting to join us and support the work. Definitely like things that we learned. If at first you don't succeed, try again. General life lesson, but also helps here. It a lot of times did take a long time. It's always ongoing, even now, especially if we got it in implementation. We're kind of going back to the drawing board of the very beginning and realize some of those partnerships like fizzled or faded. And so it's continually getting back in touch with people, and there's also staff turnovers, new leadership at organizations. And so sometimes the support wanes or people were really on board and then it kind of fell. Again, of course, we can't not talk about COVID in the sense of like, that's pulling so much focus, energy and attention. We weren't dealing with it back then, but it's something you just have to continually work on, is like going back to people and checking in with them. And if you don't have the relationship, find someone who does. We actually have improved a lot with our relationships in the southern half of the state, but we're based in Chicago, and so we physically aren't down there. And now, of course, we're not traveling very much at all, or not at all, into other regions. And so we're working on building that up. We also, again, like I said, we added a community engagement, someone who specifically works on community engagement. And that's been really key. And again, so find those people that do have the relationships and finding champions. And it's just something that we will never stop doing. And it's just ongoing forever, that work. And then it's intergovernmental partnerships is something else that really moves the work forward. What are the benefits of thinking about what are the benefits of governmental partnerships? Defining partnerships and who's doing what. That is something that we've learned too. Again, when I talk about going from kind of that loose organic conversations to more structure, and then really just kind of laying out responsibilities. Like if you get that initial buy-in, who is dedicating staff to this effort? And do people think that's important? Are they prioritizing that? Or is it just something people, they'll send an email to their group, to their staff or, their teams, but who's actually going to be doing the work? who's contributing resources or time or money? Or there are other people going out to get fund? Do you have dedicated funding to this, dedicated staff? Who is taking the lead on staffing work groups, administrative tasks like doodling for a meeting and setting up the actual conference line or Zoom, and who's convening the meetings, who's facilitating the meetings. Just sort of getting that all on the table, or making that part of the conversation, because a lot of times if we definitely run into situations where it's like people were assuming, oh, I thought you would do that, I thought you would. So who's really who's doing what and what are the responsibilities? And also tapping into planning bodies, like what that looks like in Illinois. So I have, this is alphabet soup down here, but that's CAHISC, which is the Chicago HIV Integrated Planning Body. And then the second one, IHIPSI, is the Illinois, again, HIV Integrated Planning Council. And so these are existing groups. They're supported by the government. Again, the Chicago one supported by Chicago Department of Public Health. IDPH supports the statewide one. And tapping into that, getting on their agendas, getting support from them, and getting input from them is really key. They're already convening, they're already meeting, and it's important to really get that support and buy-in from those groups as well, that we found, and that really helped us. But there's challenges to this. What do you do if your relationship with a governmental agency or department is adversarial? It's not always, people don't always get along. Obviously, maybe priorities don't align. Maybe they're not thinking about ending the epidemic or don't care about it. And what if also those bodies don't get along with each other? So I don't have the answers to that. Again, that's something we can talk about either in the chat or Q&A, or just email later about, but it's something to keep in mind. And also those relationships can change when there's like a change of political power, or even a change of a staff turnover, that things can be great and then go south. And so we have, again, navigated some of those changes. And I think it does also obviously come back to the mission and the goal of ending the epidemic, and the mission and goal of health departments, like your HIV sections. We really are aligned. And so that I kind of always come back to that. We do want the same things. And so just kind of pulling together on these, on ending the epidemic, is something that can kind of ground you again. Okay, community engagement is what people, again, kind of mentioned in the poll. So I just want to dive right into that as well. That's a whole other element of this. So what worked for us with community engagement? Reviewing Denver principles and MIPA, with meaningful engagement of people with AIDS. That's how it began. I guess now it might be people with HIV and AIDS, is how we would phrase it. But really talking about meaningful engagement of people and what that means and what that doesn't mean. And trying to make sure that people are able to be heard, and that they can see, not trying to, like making sure, ensuring that people are heard, and that like they can see what they want is then reflected in the plan, and that there's a feedback loop, and that people's concerns are listened to and addressed. It is really important. Also, something that worked for us was attending United States Conference on AIDS. I know this year, I believe for all nonprofits or people that work for health departments, it's free. It's virtual this year. And that really helped me. I said back in 2017, when I didn't know really anything about ending the epidemic planning at all, listening and networking with other ending the epidemic planning people really, really helped me. It's really what kind of got my head in the game. And that helped a lot. I'm really hoping to do that again this year. Last year, because we were so just focused on publishing the plan and implementing it, I kind of drifted from that. And I really would like to get back to talking with other people doing the same work in other jurisdictions, creating kind of a network, especially across the Midwest. I'm really interested in, because it's challenging, and we're not alone though. It can feel like you're doing it by yourself, but there's people across the country doing this. Using, again, our champions to connect with community. People don't necessarily know me or my face or my name. I just, like I said, I'm someone that cannot just go into every community and just be like, hi, like, let's chat about HIV, so really using champions, the people recognize that are already in the community, that are already doing the work, getting them excited and getting them on board helped. And also using existing support groups or groups that already exist, and working with them instead of just, again, no, there's not people, like I said, even with Getting to Zero Illinois, the average Illinoisan, just like wouldn't know what that is. And even some people in the public health world wouldn't know what it was or don't know my name. But if we get people who are already out in the community, that really helped in getting their buy-in and then going from there. Lots of planning, of course, with anything that helps. And then more planning, really just trying to think about on the back end what we can do, again, to help folks meaningfully get engaged. And I'll get into a little bit more about what that means in the next coming slides. But then organizing materials and creating tools. Again, I'll talk more about that in slides coming up. Some lessons learned is where did we fall? Some things we learned, where did we fall short? I do feel we fell short in the engagement of trans women. We definitely did have a group that was a focus group, for example, that was focused on trans women. And we have engagement here and there, but I think that we didn't have enough, to be honest. And especially creating that loop of getting people engaged, but then like following back up because we didn't have kind of like enough existing relationships. And so that's something that I think we want to continue to improve upon, especially as we're going forward into implementation. And now that we do have a dedicated person to community engagement. And I do think downstate engagement, something we fell a little bit short on as well. Again, because we are based in Chicago, we have relationships throughout the state, and AFC is sometimes, we do policy work across the state. So we are a bit more of a statewide agency than our name might imply, but because we're not based downstate, I do think that's something we need to continue to work on. And again, because again, I work at AFC, but I work on Getting to Zero, which is a statewide plan, but sometimes there's the perception that like it's a Chicago thing. So that's something we're continually working on as well. And also data analysis, again, having enough time to collect data and then really dive into the analysis and then following up on what we learned is something I think we could be stronger in. And we're working on that right now for our second round of community engagement as we go forward. It takes a lot of time. That's kind of a theme you learn. It just takes more time than you might think, but it might not take as much money, and it does take money. And something, for example, providing people stipends for their time, providing them gas cards or bus cards. Again, if you're doing virtual things now, that might not be as relevant. And we used to always provide food at our meetings too. Again, if everything's now in a virtual space, but we are doing like raffles and giveaways for people, again, to make it something that is enticing and fun. Everyone's doing so much on Zoom now. We want to try to make it something that stands out, and that's something that we're not just taking, we're also giving people. And then also one thing that's not on here, but also creating that loop where you tell people what has been done with the information when you're doing engagement, and so they can see reflected in your actions and in your plan, like what the ideas that they put forward. This is like a snapshot of the kickoff of our, this was in the summer of 2018, where we started our work group work. We had done all of our engagement activities, and we invited everyone to come together and kind of kick off the work and divide people into work groups if they wanted to be in them. And so this was just, again, this wasn't even everyone, but this was just at the lunch break. We got a picture of folks who were helping. And we did 3 specific activities for community engagement to build the plan. One was a town hall series. So you can see that we're divided like in the Ryan White like regions for Illinois. There are these 8 regions. So we did one town hall, in-person town hall in each of these 8 regions. And we actually did 2 in the Chicago area, which you see as region 8 just because of the population density. We had 320 people in total participate. These were like a World Cafe style situation. So we had 4 key questions, and they were at 4 tables, and people rotated around and addressed the questions. Like, for example, one question was, if money or politics was no issue, if we had all the money in the world and like a really supportive governor or mayor of your town, what would you do to end the epidemic? For example, like what plan would you put in place, or program or policy change? We also asked, when you're looking at your community right now, what are the barriers to either getting on PrEP, or what are barriers to receiving consistent HIV care? So things like that. So we asked the same questions at all the town halls. We also had focus groups. We realized that we did not, those town halls are just one night or afternoon or weekend. not everyone could come out to that. So we wanted to make sure that we were hearing from our party populations. So these are the focus groups that we did, and we asked pretty much the same questions as we did at the town halls. But for each of these, as I'm looking over, we had existing support groups or discussion groups that were already meeting kind of give us one of their meetings, basically. And then we worked with people who were running those groups to facilitate. So we gave them we made a facilitation guide for them. Again, we had stipends, we provided food, we had them recorded, and then we again transcribed all of the notes. I had a transcription service do that. And so we wanted to, again, make sure that we were not missing anyone out on the focus and the town halls, which were kind of open to anyone and everyone. These were more like intimate conversations. And then we also did a survey. It was online and on a paper survey as well. We brought it to each of the town halls, but we also then sent it out to all partners across the state and all those regions. It was in English and Spanish. It was 24 questions about yourself and also ideas of getting to zero. Again, the same questions we asked at the town halls and then the focus groups. It was open for 24 weeks. Again, it was originally not going to be open that long, but again, we were not getting enough responses, especially from our priority populations. We weren't getting enough from downstate, so we kept it open, but then that extended the time for analysis as well. So that's one of the things of it taking longer than you think. But we had 408 total responses to analyze. So those were the activities that we did to gather input from folks around the state to get the ideas to build the plan. So we have another poll. And then after that, I think we could also, if there's questions, Adam, this might be a good natural break for that. So the question, as you can see, what community engagement methods would or have made the most sense in your process if you've already been building a plan, but if you're planning on it, what of these would be the thing that you would do?
So Sarah, I've got the poll up, and while we're letting people vote in the poll, we have a couple of questions. So first, from Julie Patterson, she just gives a little bit of background. So in Ohio, our Ending the HIV Epidemic planning is in Franklin, Hamilton, and Cuyahoga counties, which is Cleveland, Columbus, and Cincinnati. And we are constrained by timelines from the CDC.
Yeah.
So there's that.
Yeah.
And then her question is, in your commitment to the MIPA, did you have visible leadership in the process by people living with HIV, like facilitating meetings, staff, those types of things?
Yeah, that's a great question. Yes. And again, I think that's something we really strove to do, and I don't think we totally succeeded, but I think especially in the focus groups, we really wanted to have people, I can talk about this, I think visible leadership too is so important. And so we really wanted to have people that were of the community, that people already knew, people living with HIV in the areas that people knew, again, especially traveling into the central and south, people had no idea who I went to all of them and it helped facilitate all of them, but people did not know me. And I'm not living with HIV. And so we would have a local, a key kind of partner agency that would co-facilitate and really helped us find the space. And then so a lot of them were at libraries, things like this, or community spaces. One was at a hospital, meeting room where people were used to kind of going and talking about these issues. And then having them kind of do the intro and kind of why this was important to their region and things like that. So that was something that we really worked on for the town halls. And then the focus groups too, like I said, I actually wasn't at most of the focus groups. It was people that were already, again, kind of leading and living, either living with HIV or serving folks living with HIV. And then I also say in terms of the work groups, which we'll talk about in a bit, but and also our steering committee. We wanted to make sure we had people living with HIV there and that were kind of known in the community. Again, because we just want to make sure that that was kind of out there. But I do think we could increase the percentage, and that's something I really want to work on for implementation work groups as well, and make it even more so. So I am GTZ staff are more on the helping behind the scenes and not out front as much.
Thank you. And we have just a couple of other questions as well. So we have someone who's a native of Southern Illinois, Wabash County, and they're happy to hear that you're engaging people in the southern part of the state. And they wonder, are there any specific strategies you're using to link with folks in rural areas?
Yes, I said I think that's definitely, hello, also a person from Southern Illinois. And I think that's something that we could use help on, I guess that, or could build up. In terms of reaching folks, you know, there are, of course, already, we're looking at, again, there's obviously health departments there, you know, that, and places where people receive care and like support groups. But I think that, and we're also kind of working with folks that are doing telehealth, like, and especially teleprep. We want to work with folks that are doing that. And we also are looking, again, I said at, there's also kind of peer networks, you know, peer leaders in each of those regions as well. And so they just recently, you know, they have monthly calls where, again, like where the peers are kind of do organizing amongst themselves and like troubleshoot. And that's something we've been trying to tap into more, is the peer networks that are, again, are already doing that and that are kind of reaching out to folks, especially now. Again, this didn't apply back when, you know, we were planning, but now with COVID, a lot of people were organizing and trying to get themselves organized online. And we've kind of been trying to tap into that and are reaching out to people more too, saying like, what do you need? What support do you need? Of course, that was all happening before, but we've been really trying to tap into that. Like if there are meetings about reaching out to do services or like getting more information out about telehealth, trying to like piggyback on that as well. So that's some of the things that we've been doing. But again, I think we really would like to expand expand our strategies, like I said. And I think one key thing is that we now have like a person really dedicated to doing that. She's joined us just this year. And so for having her kind of out there more and just really making it known that like we have a person dedicated to this. So however people are gathering and wherever they're gathering, online or in person, we want to try to be there.
Thank you, Sarah. And we've got 3 more, and we'll go through these 3 questions, and then we can do the poll and move on. Is that okay?
Mm-hmm.
All right, cool. So one question is, what did your representation of people experiencing homelessness look like? And what strategies did you use to do outreach to people who are homeless, who are also living with HIV?
Yeah. That is housing. Yes, housing has become way kind of like moved up in our strategies, I guess, and also just like our focus in the past year. We do so at AFC, we have the Center for Housing and Health, which is totally focused completely on housing, and so that is something where we have tried to work with them in terms of when they are doing, again, so. Because I think another thing we've definitely learned with GTZ, like getting to Zero Illinois, and like what we are, like what are we, who are we, and what's our role. We don't want to reinvent the wheel, one, because it would take too long and that's, you know, not efficient. But it's really trying to find people that are already doing that work and trying to, again, talk to them about how our values are aligned, and so that we can just kind of get our message or our programs or our ideas kind of out through them. Again, because it's not something obviously that I would go, like, you know, me to go out and do myself. So the Center for Housing and Health, we've really tried to partner with them. And so when they are talking to people and providing services and doing kind of like the checking in with them or checking up with them, also when they're getting people housed, of course they have, you know, connection with them, and they have like welcome kits and things like that for when they get into their new home. Having GTZ information for them, and then just getting kind of the word out that we exist and inviting them to participate. But I know that the actual participation though has been a challenge. But we also have been one thing that happened the last fall is there's a statewide supportive housing, HIV supportive housing group. And we have someone on our leadership council from that group. And I also spoke at their conference. And so that was all people that are serving people that are experiencing homelessness to varying degrees. And so we've actually added 2 more partners that really, that's like their focus, is people who are experiencing homelessness and living with HIV, you know, that intersection, and providing homes for them, and also giving them support services and wraparound services. We did partner with that one agency to actually, when we were doing the survey, to have it out and available. I think at one of the food pantries that they had. Also, they have set that up for the community. We had people there asking people if they wanted to take the survey, helping them take the survey, either paper or like on an iPad. So making housing and people experiencing homelessness and living with HIV, we really want to make that a lot more central to our work, though, in the coming year as well. Talk about the focus areas. Housing is, they're going to have a work group this year as well. So I think it's also getting more housing agencies on board, and getting also ourselves to sit on someone from GTZ to be on our, don't know what the name of it is, but there's a HIV housing task force, maybe it's called that, in Chicago, and seeing if we can get a spot either to listen in or to be on that task force. So we can also be more intentional about reaching out to folks who are experiencing homelessness and bringing them into the process and hearing, you know, what their needs are. Was there more, Adam, or?
We got, yes, we have one more right now. So someone is wondering if you have suggestions on the best practices you use to narrow down or organize strategies for the plan.
Ooh, yeah, yeah. Oh man, that was, so I would love to maybe email with that person, but yes, because that was a process. It was huge. We had so many pages of, again, like we had the survey data, we had focus group notes, we had that World Cafe notes. And then we had another, I remember after even all of that, when we first had our draft, we had another like dinner. It was like a community dinner where people could come, have dinner, and then kind of see our draft strategies and do rankings of that. So it was a massive amount of information. And then, yeah, to make it a coherent plan, again, that's why it took 3 months of that when we thought it would take 1 month. Some strategies are, we tried to rank, we had our steering committee try to rank things, to rank things on feasibility and impact scales in terms of how possible, like, you know, because people had a great, lots of ideas, and some were very granular and some were huge. And so looking ahead at, like, looking at budgets of the state, looking at current like priorities of states, looking at their health department, like teams and like different CBO agencies, what would be possible within the next 10 years. So some things where it would not be very possible, some things we could do like in the next year, some things we could do maybe in 5 years. We also had them rank them on impact, which again, I think is a little more subjective, but just how they thought, like, if it could have a high impact, or like this would really, I mean, if we could just get X, Y, or Z done, it would be amazing. Or if it would be nice, or it would just kind of, if it wouldn't have a huge impact, or it would only impact like a really small group of people. So we did have them rank on feasibility and impact and kind of try to mesh those together. We also created large themes, and I don't know if we get to that in a couple of slides, but just we have like fitting things under healthcare, fitting things under the like workforce, like we had a whole thing on HIV workforce and workforce opportunities. So just grouping things to kind of in larger themes and kind of sorting them out through that helped, where we could see where we can combine some things. We did keep a whole, we had like, we have this huge thing. We never threw any idea away also, just to say, and we tried to really communicate that back out to people that we kind of kept this plan itself broad in the sense of, we have goals we want to achieve, obviously, like increasing PrEP use, increasing linkage to care, but we didn't say the how. We didn't like prescribe how to do that in the plan. And when we broke off into work groups to do implementation, we still have all the ideas from people, though anything that fell kind of like under PrEP, or anything that fell under housing, or anything that fell under food security, we have all of those ideas that people can then say, like, these came from the community, of these are maybe like how you might achieve some of the goals that we set in the plan. But we had, there was like a workbook that I put together. For the steering committee when we first were narrowing down. But I'd love to follow up with people about, more of the nitty gritty, but it was definitely a process, and it was a lot to kind of funnel into a plan.
Right. Thank you, Sarah. I'm going to go ahead and end the survey.
Yep.
And then everybody should be able to see it.
Sure.
The results. There we go.
Okay. So these are more like pretty evenly spread, or a little bit more evenly spread. So again, the question was about like what would make the most sense. 33% of people said a survey, 44% said focus groups, 21% said a larger listening session or a town hall or something like that. So that's kind of how it was spread. So it was about, again, 33% of survey, 44% focus group, 21% town halls, and then 1% said maybe something else. All right, I'm gonna keep on moving here. Language accessibility is just something that, again, was something that I think we weren't thinking about it as much at the beginning, and we kind of built it in as we went along, but starting it out at the outset would have been a huge help. We needed to add money and time to the process to publish in the plan in Spanish and English, but also the supporting materials, like engagement materials, focus group flyers, the survey, translators. We had one group that was Spanish speaking only. And again, we quickly realized that was something we needed to do, but when we were first charting out, again, our timeline, like, oh, here's when we can do this, this, and this, planning in the turnaround time to like send something out, get it translated, get that checked, that did add time. And so it was something we ended up, it was all right, but would have been much better to have that in our minds from the very beginning. And also just sort of again, not just the plan itself, but if you're going to make a flyer, and then it's also, if you do that, then you need to have any fact sheets or just things that you publish and print. It needs to be all throughout, because there will be supporting materials as well. So it's something, again, that we corrected for, but at the beginning hadn't planned that out to the logical end and all the implications that would have on timing. Tools that we used that I'd be happy to share with folks if they're interested, but we had kind of an organizing chart for the focus groups in terms of who would do what the roles would be. We had a flyer. We had a sample email to recruit people for it. We had similar things for the town halls, the flyer. We had the roles list, a checklist for the day of, and then we created a full meeting facilitator guide, but then also a small group facilitator guide. As people mentioned, like we tapped people from the regions and the local communities to facilitate, but we didn't want to just say, just throw them out there. We wanted to make sure we're trying to make it even across all of the different activities. So we created a guide for them and went through it with them beforehand and had a facilitator call to prepare people. The challenges, again, are tight timelines, like I said, and maybe this sounds like luxurious for people that are working within the Ending the Epidemic federal timelines now, but we did 7 outside of Chicago town halls all in 1 month. We did all of our focus groups within 6 weeks and all the data analysis in 1 month. And at the time, it felt like I was just on a speeding train that was just hyper speed. It felt very fast. I said, even though and again, it's probably more a luxurious timeline than folks are dealing with right now under the Ending the Epidemic federal guidelines. So it just all seems to go really fast, and you're trying to adhere all the time to creating feedback loops to the community, like we mentioned, and then also uplifting and making sure that people living with HIV and receiving services are put into leadership roles, but it's also preparing people for that. And we've learned that too, in terms of just putting someone on a board or putting someone on the steering committee without preparing them to participate and supporting their participation is also detrimental and not really living out, like I said, our highest ideals. So that was something that we really are continuing, again, to work on in terms of making sure that people are supported in their participation. But yeah, so all focus groups were done within 6 weeks. All 7 were done with community partners, but it did just require a lot of coordination in terms of money, consent forms, invoices, audio recordings, traveling all these things all over the city in terms of the focus groups was difficult. We did it, but yeah, it was an intense month for that. I'll just move on into again. So then we had work groups that were created as well. So after we gathered all of the ideas, we created work groups to actually sit down with those ideas and try to organize them into a plan. So we built, building our core group using, again, kind of connections and suggestions from people that were already involved in the process, or that we kind of picked up along the way, whether they were town hall participants, focus group participants, focus group organizers, reaching back out to people individually, following up a lot, casting a really wide net, and again, kind of providing support for people in terms of explaining what it is we were trying to do, if they wanted a call, if they wanted to meet with us, providing monetary support for their participation, like a stipend, thinking about childcare, if people needed that. So there's a lot of that again, when you're just getting, if you do get like funding, or a lot of times that's not built in. When people say, we want you to do this plan, they don't give you money for like food and childcare and things like that. So it's something that we had to think about and like pull our resources from other places or our partner agencies as well. Again, tools that we use, we had a flyer to recruit co-chairs for the groups. We had then a separate flyer for members because there was different, time commitments. We did a kickoff slide deck for our work groups, to kind of let them, we had them each go through the same kind of explanation of what we were trying to do. We had a template. So again, they were sitting with all of these ideas that we had gathered. We had a template to create a recommendation. And then we asked each group to have, I think, like 10 recommendations. So we had a template for them in terms of like whatever recommendation that you want to go into the plan, like what area is it addressing? Like what community will it help? What is the timeline of this? And again, like what goal will it achieve? So it was kind of spelled out. So it gave them some uniform, it was like a worksheet, so they could all kind of come in. It would also then be easier, as someone mentioned, like how did you get all those ideas down? When we're getting all these worksheets, they were all a similar format, so it helped us process what was coming in from the work groups as well. And then from the beginning, we also gave them a timeline, an accountability tracker just to help themselves organize. It wasn't like so much accountability to us, but just to each other, so that if someone, like, you can say who's going to do what by the next call, and then just making sure that people followed up on that. The challenges for that, creating and maintaining momentum is difficult when someone, again, this was all like a volunteer basis, and it was not really, for your central job. It was just something you're kind of doing above and beyond. Group editing is very difficult coming to a consensus. It takes a lot of support for people and also reminders. It's kind of like homework assignments, and we have to kind of nudge people or just remind them, like, our deadline for getting our first draft was a week ago. Can you help us get your part of it in? So setting up a process up front and laying out clear expectations and establishing open lines of communication were all important, but also challenging. At first, we struggled with how to let group leaders take true ownership, like what to leave off their plate and what to put on their plate. What we found was like providing support for a lot of just like the administrative stuff. So like all the calendar invites, all the doodle polls, all the conference lines, agendas, and notes, we wanted to take off their plate so that they could just kind of discuss and brainstorm and things like that. So it was just taking on a lot of that work we found was a challenge, but also helped move things forward. And then how it came together. So again, those committees that were formed, they met through the summer of 2018. Again, the community feedback on the recommendations. So yeah, we got all those recommendation sheets back. And then that's when we had that dinner that I mentioned. And then we had a smaller team edit. We released a draft on World AIDS Day, and then we got community feedback and incorporated that into the editing and translating and everything to release it in May of 2019. And the product is the plan. As you can see online, these are the guiding principles that we came up with that really underlines all of the work. And it cannot be done and it cannot be successful unless we work towards eliminating stigma, work towards dismantling racism, prioritizing trauma prevention and trauma-informed care, cultural humility, and focusing on data. These are the themes that we ended up coming up with that I mentioned. All of the strategies fall under one of these. themes. And then, yes, so these are just kind of what's in the plan. And these are the focus areas that we picked. Again, that not when I say we, our steering committee, our leadership group picked, again, through a process of like, yeah, having the highest impact and the highest feasibility. A quick update was that work groups, yes, take a lot of work. And we're probably going to cut down to manage and just, again, maintain momentum. We'll likely cut down on the number of work groups we have for the implementation years that are going forward. Each group will find its own rhythm, cadence, and way of working. And we are exploring some of these alternatives to work groups in case there's kind of the standard having a monthly meeting, doing things in between, and then meeting again doesn't end up working because, again, it can be hard, especially dealing now with COVID, to keep momentum going. And then I know we're quickly running to the end of time here. Just to say about funding, again, this might not be applicable if people are only using federal funding. This was before all of that, so we at AFC secured funding from a foundation to help support the work. We started small, again, leverage existing funding. We had a funder breakfast to kind of get the interest of funders. Being organized, showing our intersectionality, and demonstrating our alliances helped. It can be tough to get money for this type of work. It's hard to quantify what you are delivering. Timelines are always a challenge, and connecting HIV to larger and broader health issues can also be a challenge. But yeah, so that is just some of the challenges we're into with getting funding. So I know we're really coming to the end of time. I wanted to put up my information here. I would love to talk more with people about this. And again, this is obviously lessons learned and challenges. Of course, we did not do it perfectly. We are continuing to imperfectly work towards getting to zero. But that was some of our process to create our plan.
Sarah, thank you so much for today's presentation. Right now, we don't have we don't have any questions, so I wonder if we could maybe hang on for a moment and give people an opportunity. Okay.
Yes.
So everybody, if you do have questions in the next minute or two, put those in the Q&A function and we'll address those. But it does look like most people enjoyed the conference or this session, so that's great.
Yeah, it's great. And like I said, I'm not, just because I'm sharing my screen, I'm not looking at the chat right now, but yeah, would love to, again, talk more about it. So this was all kind of about building the plan. This 2020 was our first year of implementation, which of course was not, 2020 was nothing that we expected or planned for. And so that's a whole other conversation that's kind of where we are at now, is implementing. But yeah, I am interested in talking more now or in the future with people that are making their plans or implementing their plans, and just seeing how other people are doing it. Because sometimes you can feel like you're just kind of out there trying to put this thing together. And I know that there's people across the Midwest and across America working on this. And yeah, would be interested, in just creating kind of a network of people that are moving their plans forward.
We do have a question from an attendee asking, was there anything that came out of your plan that was a surprise to you or everybody else that was working on the plan?
Yes. I'm trying to think of what can I how to succinctly answer? I think, there's something that was, there was a lot of stuff, and this is more not that kind of showed up in the plan, but something that I kind of realized along the way. I think a lot, so many people had such great ideas. Like I said, when we had the town halls, when we had the focus groups, people really were really honest, and talked about what they need and what their barriers were. Something that was interesting to me was that I think just because of, we're not Illinois is a pretty big state, pretty geographically spread out. But I think there were a lot of people, what I realized is that stuff was happening. A lot of ideas that people had were actually happening in either small like a pilot, you know, project of this, that, or the other, or happening, or there was a whole organization working on it, or a whole coalition that was wanting to move it forward, and people just didn't know about it, you know. And so it's like, and then when we go to other regions or something, people are like, oh, we're actually doing that, or this agency is doing that. And like things are happening, even like teleprep, for example. A lot of people in Chicago are like, oh, teleprep, like, should we be doing this? And like, it's actually happening in Southern Illinois already. There's like teleprep pilots and projects going on, but it's not very widespread up in Chicago. And so I think we saw that like one role for Getting to Zero, instead of, again, kind of doing many things, or like starting, you know, programs and things like that, it's kind of like coordination, collaboration, and like communication role, and is really just connecting what is happening across Illinois. And it's siloed. It's more siloed than I thought. And so that is something that really, I was like, wow, I was surprised, because when I see all these ideas, I'm like, oh yeah, that is great. And then I was always surprised when someone says, oh, you know, we're actually doing that already. But maybe it's just that we need people to help either scale up, you know, or do some best practices sharing or things like that. Because there is a lot of I'm surprised. In some ways I'm surprised, in some ways not. There's amazing work going on in every region of Illinois, and I'm sure across every region of every state. But just kind of like that we need to share more with each other, and have that communication and that awareness, so that we can build off of the great work that's happening.
Right. Thank you, Sarah. We don't have any other questions right now, so I think we'll go ahead and end today's session. Thank you for taking the time. This was great.
Yeah, thank you.
And for those who are attending, we hope to see you tomorrow. Tomorrow's session is The Changing Landscape of Harm Reduction, presented by Tasha Turner Bicknell, who is with the University of Cincinnati College of Nursing. And again, thank you, everybody, and have a great day.